I want you to think of your favorite food. For me, it's my grandma's homemade mac and cheese. And behind the food are memories of sitting in her kitchen and listening to her stories. Now, you may not be as much of a foodie as I am, but we can't deny how important food is to all of us, both socially and culturally. But what if you could never eat your favorite food again? What if you couldn't eat or drink anything? What I'm talking about is something called dysphagia, or a difficulty with swallowing. It describes the problems patients have with food and liquid going down the wrong way or getting stuck in the throat. Affecting 1 in 25 adults, dysphagia can cause malnutrition, dehydration, pneumonia, or even death. Luckily, there are speech pathologists who work to improve swallow functioning. One way they do this is by coaching patients to use different head and neck postures to reshape the throat, which protects the airway and helps food move down easier. These are two of those strategies. Now, if I were to ask you which of these strategies is called the chin tuck, could you guess which? I'm guessing you'd have a good 50-50 shot. You see, the chin tuck and the chin down strategies clearly look different. They have differing effects on swallowing, yet have pretty ambiguous names. Consequently, they're not well distinguished, with researchers and clinicians referring to both of them as the chin tuck. But why does this matter? Well, imagine a nurse giving a patient the wrong medication just because two medications sound similar. In our case, these strategies are like those medications. If they're not clearly communicated, they could be incorrectly administered. Further, we only have so many strategies to try with our patients. So if we condense these two terms into one, we're taking one tool out of our clinical toolbox. Therefore, my team decided to set the record straight. We're conducting a mapping review, looking at all studies analyzing swallowing in a downward chin movement. After collecting over 2,000 studies and screening them, we have remaining studies that we're categorizing as investigating a true chin tuck, a true chin down, a combination of the two, or too ambiguous to tell. Once complete, we'll create a visual map for the field of speech pathology, setting the stage for accessible resources, clear definitions, and improving patient care. Words matter, and they're the difference between a patient having a feeding tube and getting to enjoy their favorite food. Thank you.